So I'm going to ask you some general questions and then also some personal questions. So I'm going to start out with general questions. On average, what is the salary of a plastic surgeon?
On average, the salary of a plastic surgeon depends upon where the plastic surgeon decides to practice. If one finishes training and a plastic surgeon ends up in a large metropolitan area such as LA or New York, the salary is going to definitely be a lot higher than if a plastic surgeon sets up shop in Fort Smith, Arkansas, or Fayetteville, or Nowheresville, USA, so to speak. So on average, the price tag for an annual salary may range anywhere from $120,000 to $700,000.
Okay, what are the daily tasks of a plastic surgeon?
The daily tasks of a plastic surgeon are all-encompassing. You're always responsible for your patients, and you have a huge staff that assists with this. Most plastic surgeons will have a blend of clinic and OR. There may be reconstructive patients or there may be cosmetic patients. The reconstructive things are definitely what we call medically indicated or medically necessary, whereas the cosmetic patients are the fun stuff. And that's not necessary, but the patient that's getting that cosmetic surgery feels that it is.
So a lot of people, especially people my age, in the 8th grade, and it's obviously coming to the end of 2018, it's becoming 2019. What do plastic surgeons do in this time?
Plastic surgeons do lots of different types of procedures, again, from a reconstructive standpoint of removing skin cancers because of sun exposure and years of sunbathing, or from facelifts or breast augmentation to the fun stuff. Those are the cosmetic things, plus trauma. We have trauma where a patient may end up with a facial fracture or a tendon that's damaged in the hand. We also encompass fun things like filler products or Botox. We are the pioneers for those types of treatments within the realm of cosmetic surgery, in addition to skin care and laser tattoo removal.
So, why do surgeons and doctors and anyone with an MD or a PhD, why do they have horrible handwriting?
I think the writing or the penmanship of all of those disciplines simply is based upon the fact that we have a lot of writing to do, especially in training. And so the faster you write, the worse the penmanship becomes.
So now on to the personal questions. How long have you been practicing?
I started the division of plastic surgery for Cooper Clinic in 1997, so that's 21 years.
So what schooling and training did it take for you to become a plastic surgeon, and how many years did it take?
It was extensive. I finished high school here in Fort Smith. Then I went to the University of Tulsa for 4 years. Then I went to the University of Arkansas for Medical Sciences, which is medical school, for 4 more years. Then after that, I did training in general surgery for 5 years. Then I went on to train in Boston at the Leahy Clinic and Brigham and Women's and Boston Children's Hospital for plastic surgery for another 3 years. So that will give you a total of about 16 years after high school.
Okay, so what do you yourself do every day?
I get up, I have a good cup of coffee, and it's often long before the sun rises. I take care of things here at home. Then I head to the office or to the operating room. 2 days out of the week, I'm in the OR. If I go to the OR, then I'm wearing scrubs. Otherwise, I wear just normal clothes to work. If I'm going to the office, I'll check everything on the internet or on the electronic medical record to make sure everything is prepared for the day and for the next few days. I always have to look ahead. If there's anything that needs to be checked with regard to lab work that I've already ordered on some patients or pathologies that have returned, I check that. We're connected by so many avenues for communication, so I check all of those, including email. then often I'll have procedures that are scheduled that day, so I prepare for those as well.
What are your working conditions?
My working conditions in the office are just normal office setting with lots of different implements to help me do my task with a very large staff. In the OR, my working conditions are that it's about 64 degrees in the operating room, big bright OR lights, wear scrubs, it's a hard concrete floor, so really good shoes. And we do several cases each time I'm in the operating room, which again is Tuesday and Thursday or 2 days out of the week.
So, what does it take to run your plastic surgery office? In other words, what are the personnel?
It's a huge personnel. Not all just right there front and center in the office, but there are a lot of people that are behind the scenes. So right there in the front office, there are 2 people that are answering the phone, receptionists. They are scheduling patients, answering questions, trying to make people feel very comfortable. I also have a scrub nurse who helps me in the operating room, goes with me from the office to the operating room, in addition to a nurse who stays in the office. As a plastic surgeon, part of my expertise are chemical peels, injection of Botox, injection of filler products. I do all of those things, plus while I'm seeing patients, my nurse may be using my laser tattoo removal machine to remove a tattoo, which takes a series of treatments on a patient. My nurse may be doing a chemical peel. In the operating room, there are plenty of nurses that check the patients in, plus monitor the patients after they're recovering from their general anesthesia or sedation, and then they check them out. Plus, not to mention the multitude of individuals that it takes to get through the insurance pre-certification for each patient to go to the operating room if it's medically indicated, as well as those for collections that are involved and the coding that's required for each specific procedure.
So, if you were to take me on a tour of your office, what would I find inside?
So you'd come on in, of course you see the standard waiting room with the chairs and a little more posh, a little more nice than the regular doctor's office than you've been to. Got to be comfortable in the plastic surgeon's office. You'll see the routine setup for patient education DVDs. You'll see a treatment room, that it has a treatment room chair and a big OR light in case I need to do any kind of surgical repairs there. I've got suture, I've got sterile surgical instruments, I've got the Pico 4, the latest in technology with regard to laser tattoo removal, also treats for skin irregularities with fractional treatment. I have a machine called Vanquish, which is a radio frequency machine in order to accomplish fat dissolution. I have another machine called an Ultherapy machine, which is, in a sense, stimulating a collagen synthesis and elastin fiber synthesis in the tissue to sort of shrink wrap the skin around the face. It tightens the skin for the face. You would see cabinets with filler products and Botox in them, garments. You would see a personal office and, of course, the water machine and coffee pot.
So, what are your hours?
My hours are Monday through Friday, for sure 8 to 5, but it's also much more broad than that, because going to the operating room, the OR starts at about 6:10. The earliest check-in time for a patient is 5:45 a.m. Often we don't get finished with work until after 5:30. Also, there's on-call time. I'm always on call for my patients if a patient has a question after hours. It's not like going to the bank where you're there just by day. It encompasses 24/7. I'm also responsible for the emergency room on-call patients. If the emergency room physician would need a plastic surgeon, they can call me anytime, but I am required to be there at least 10 days out of the month.
So, how often are you on call?
About every 10 days, or about 10 days out of the month.
Okay, thank you.